Hi, I'm Rafael.
Hi, I'm Kaitlyn.
And I'm Jacob. Welcome to 1966, the show set in the year of 1966. Today we have our guest, Elizabeth June Yerxa.
So we have a couple questions for you today about the field of occupational therapy. What are your thoughts on occupational therapy today?
My thoughts on occupational therapy today is that occupational therapy is more evidence-based and it's a more holistic practice. And so with that, it is more client-centered. And so we are goal-oriented for the individual, making sure we are doing what is okay for their needs. Before, we did a lot of research and we were just looking at way too many things, but now we know that theory and practice go hand in hand together for our field.
What do you think people think of when they think of occupational therapy?
I think people, especially in 1963, the dean at the University of Washington said that occupational therapy shouldn't even be a practice. And with that, a lot of people don't take occupational therapy serious. But as time progresses, we are showing that it is a big deal and we do need occupational therapy, but it's just a progression and we need to be more authentic and show people that we can be professional as well.
Okay.
It's not just about what you're wearing and how you see yourself in a profession.
Okay.
So what do you hope people view occupational therapy as?
I hope people view occupational therapy as an actual profession and don't just take us as a joke. We're here to do research and be more knowledgeable and show that in a patient and to do different things depending on what field we are in. So with that, we have different fields that occupational therapy therapists can work in, so like the hospitals, home health, other care programs and rehab centers that we can work in. So I hope people see that and take us seriously.
Due to civil rights movement, how does that affect you as a woman in the occupational therapy field?
So as a woman, getting a college education is something huge right now. Civil rights, we want to be equal to man, and we want to show them that we are capable of being professional and having higher education and showing that we can help others just as good as man. And I think right now, sometimes it is a struggle because as a woman getting higher education, sometimes you're looked down upon or you don't get the respect that you need. So that's really huge.
On a different topic here, with the war going on now, how do you think occupational therapists can help?
So the Vietnam War is going on right now. I think occupational therapists can help, especially with the soldiers coming back wounded. You need to learn your ADLs and stuff to be independent again. And a lot of our soldiers are losing limbs because of the war and bombing and things like that. So definitely has an impact on occupational therapists. And with that going on, it means we have more patients and people can see us as being a real profession because we're helping them.
What impact do you hope that this interview has on the occupational therapy profession?
I hope that we gain respect. That's one thing that we're still working on. We're gaining everybody's trust right now. We're showing them what we can do. And so through this interview, I hope people understand more about occupational therapy. And I hope they understand that there's so many different fields that we can work in. It's not just one simple thing or just in the hospital or anything like that. We can do multiple things, and I just want other people to know that. And I also want them to know that it is definitely evidence-based and it is focused mainly on the client or the patient, depending on where you are. It's it's client-centered, so we focus on what the client needs and what are their needs, rather than putting our spin on it and having our values and beliefs on the patient.
Okay, so you talked about occupational therapy being a more credible profession. How do you think that's going to progress in about 54 years from now?
I think it's going to progress as being more emotionally involved in your patient or client, and it's going to keep growing with research and things that we can do to help our patients. With the different tools that we have to evaluate our patients, that's going to keep growing. And always staying committed to your clients. Like no matter what, you're going to be there for them. You're going to help them with their motivation because that's primary importance. You just want to help them through their activities and things like that. So in the future, that's going to be the same thing going on, but just in the best way that we can do that.
What takeaways do you want therapists and students to have from your lecture?
So I hope they take away that, one, it is client-centered. So make sure that everything that you do is based on the person that's in front of you. You want to focus on what their environment is and focus on getting them back to where they would like to be. I hope they take away that occupational therapy is always growing and it is an actual profession.
All right, so for our final question, what makes occupational therapy authentic?
So I think occupational therapy is authentic because occupational therapy doesn't force their own values on patients, but rather they show different possibilities to do something or whatever it might be with that patient. And it's also commitment to each patient and client that you have and working on the individual goals that have been set and working on where they want to be. And that's what makes it authentic because each patient is different, each person has their own goal, and that's something you can't really get anywhere else.
All right. Sounds great. Thank you for joining us today.
Thank you so much.
Thank you.
Thank you.
Thank you.
Next week on 1966, Civil Rights Gone Wild.